Hello, everyone. Good morning. Welcome to Ask Endocrinologists. I hope you all enjoying your day and weekend. I'm Dr. Grace again, and with me is Dr. Hope.
Good
We are
morning.
endocrinologists. Yes. So, if you have any question, concern, anything you want to know about your hormones or about any endocrinology disease or any question in general, we are here to answer your questions. And if today is your first time joining us, you are so welcome. We are happy to have you here. And we promise you, you're really, really going to have fun and enjoy yourself. And if you've been joining us in the past, thank you for coming back in again. Please share with your friends, like, comment, and remember the more you know, the better you are.
You are. All right. Okay. So you can ask questions on YouTube, right?
Yes,
Yeah.
yes, on YouTube.
All right. Yeah. So you just type in your questions and we will be happy to answer them for you.
All right, we're waiting for our people to join us. And I see three people already joined watching us now. And if you have any question, but while we are waiting for questions to come up, um,
Mm-hmm.
we can talk about one or two things, you
Mm-hmm.
know, uh, about this. What is endocrinology again? Who are
That's
we?
right.
You
That's
know,
All
yeah.
right. So, what is an endocrinologist? Anytime I tell people what I do, a lot of people don't know unless you've been to an endocrinologist because you have an endocrine related problem. So, an endocrinologist is a doctor that specializes in the study of hormonal disorders. So, disorders that involve hormones. One of the most common disorders that we study is diabetes because it involves the hormone of insulin, right? So it's usually insulin deficiency or insulin resistance. Deficiency in type 1 diabetes and resistance in type 2 diabetes. Um, so we are the specialists that really help treat the more complicated diabetes patients because the primary care doctor can also treat diabetes. Um, but usually, if it's a new onset diabetic, so if someone is newly diagnosed with diabetes, or if they have difficult to treat diabetes, they are referred to an endocrinologist. The other common disorder that we treat are thyroid disorders. So the thyroid gland is in the neck, and it is a hormone that is responsible for your metabolism. So we have the increase in if you have too much thyroid hormone, then your metabolism is increased. If you have too little thyroid hormone, then your metabolism can be decreased. So what can cause too much thyroid hormone? Um, a disorder called Graves' disease, where you're actually uh, your body is making too much thyroid hormone because of a genetic disorder. Um, and Graves' disease can result in weight loss. Since your metabolism is increased, you can feel hungry, you're eating a lot, but still losing weight. You can have increased sweating, fatigue, palpitations, and your heart rate is increased, so you can feel your heart beating very fast. You can also have difficulty with concentration and focus. So, those are some of the signs and symptoms of hyperthyroidism due to Graves' disease. You can also have too little thyroid hormone, and that is Hashimoto's. It's also called Hashimoto's thyroiditis. And again, that's another autoimmune disorder as well. So in too little thyroid disease, your body is too little thyroid hormone. Sorry, your body's not making enough thyroid hormone, and therefore your metabolism is slowed down. So What are the signs of a slowed metabolism? Weight gain. So people tend to gain weight with hypothyroidism or Hashimoto's. They can have dry skin, constipation, so the bowels slow down as well. Whereas in hyperthyroidism, you can have more diarrhea. Um, what else? So some of the other things, you can have weakness, hair loss as well. So those are some of the disorders and with related to the thyroid. The hyperthyroidism is usually treated with methimazole. Hypothyroidism is treated with a medication called Synthroid. Did you want to say anything, Grace?
Yeah, you actually
Oh, I
nailed
see
it.
some questions.
Okay, you see two on your hand, right? That's great. So
Uh,
there's a question. There are two
what are
questions.
some natural remedies for diabetes? So, natural remedies for diabetes include, first of all, as a disclaimer, if you have diabetes as endocrinologists, we suggest that you do get treated with the proved medications that have been proven to control the diabetes. And that includes insulin, metformin, um, some of the other agents like Jardiance, Januvia, some of those classes of their classes of medications called SGLT2 inhibitors, GLP-1s, medications like Ozempic. All of those have been proven to control blood sugars and improve diabetes. However, there are some natural remedies that can be used in addition to those medications that may help, like cinnamon. Cinnamon has been shown to decrease blood sugar levels. So that, that's one of them. And just going back, diet, diet, just a low sugar, low carb diet. Controlling your diet and weight loss, those are the key um, steps that you can take to really control your diabetes. Even if you're taking medications, you should have lifestyle interventions included in managing your diabetes. So, if you lose 10% of your body weight, that's been shown to improve your diabetes as well. So, a low carb diet, so if we have, I usually show my patients a plate, the picture of the standard plate issued by the American Diabetes Association. Half the plate should be vegetables, a quarter protein, and a quarter carbohydrates. So that means the rice, bread, or pasta, potatoes, all of that should be just a quarter of the plate. So if you use the plate method, definitely decreasing the amount of carbs is key, a key natural remedy in controlling your diabetes. Any other remedies you can think of, Grace, Dr. Grace?
Yeah, mine is just to make it simpler, like, look into more greenish, you know, the more green. So the greener your plate, the better your health, your risk of not having diabetes. Okay. So the greener your plate, the better your health, your risk of not having diabetes. I hope you can hear me. So I'm just making sure that you can hear me as well. The greener your plate, the better your health, your risk of not having diabetes. I hope you can hear me. So I'm just making sure that you can
Okay, so there are a few more questions here. Um, okay. Another question. What are the remedies for symptoms that follow menopause? Okay, so what can help menopausal symptoms? So some of the things that can help with symptoms of menopause are natural estrogen replacement. So like foods that are maybe high in natural estrogens, like soy milk, or any type of soy can replace your estrogen. So the natural form of a estrogen rich product like soy can help with menopausal symptoms. The other things that can help are black cohosh, which is another natural remedy that is really important in I've referred a lot of patients to that, and it's been helpful. So again, so soy and black cohosh has been helpful in improving menopausal symptoms. Uh, it also depends on what symptoms, right? So if you're having hot flashes, um, in addition to any of those symptoms, there are some medications that have been shown to improve it. But those medications are maybe some psychiatric medications that have been helpful as well in controlling those symptoms. um, Estrogen replacement. So people who lack estrogen, menopausal women who obviously the issue is the lack of estrogen at that age. So estrogen replacement, which has been very controversial in the past. If you don't have risk factors, then estrogen replacement can be helpful. Some of the risk factors that will prevent you from using estrogen replacement are a history of breast cancer, history or family history of breast cancer, um, maybe a contraindication for using estrogen replacement. So that those are some of the considerations and treatments and remedies that are helpful. Okay.
Okay. Um, so in general, I can say that we have question today about diabetes
A
and
few
about,
people join us. Who's Samuel Akindeji? Good morning.
yeah.
And the affectionate lime pie. Good morning. Thank you for joining us. All right. So while we wait, Grace, is there anything else you want to tell our audience while we wait?
Well, what I would say is, uh, prevention is always better than cure. So most of these medical conditions we can, uh, oh, you can hear me? Okay. Let's see what happened. Why you cannot hear me? Uh, uh, let's see.
All right. So let's see. Anything? So some of the other disorders that we treat
Can
are
you hear me now? Sorry, I want to make sure you can hear me.
we
Can you hear
treat
me
something called
now?
polycystic ovarian syndrome. Polycystic ovarian syndrome is a disorder that affects the reproductive system. So it's usually due to higher testosterone levels in women. So that's another disorder that affects your actually it can affect your blood sugar too and cause insulin resistance. So polycystic ovarian syndrome usually occurs in women that are overweight, and it because of the estrogen testosterone imbalance, there is more testosterone. So therefore, you have increased facial hair growth and maybe some male pattern hair growth as well. Um, there could be increased acne. and like I said, insulin resistance. One of the first treatments that we give for polycystic ovarian syndrome is weight loss. So if you lose, again, 10% of your body weight, that can result in improvement in your diet, in your polycystic ovarian syndrome. Oh, and the other thing is irregular periods. So many people come to the doctor's attention or present to the doctor complaining of irregular periods, and that is what brings it to our attention. So once it's treated, then the periods can return back to normal. And some of the treatments for polycystic ovarian syndrome include, in addition to the lifestyle modifications, weight loss, birth control pills, and some medications that help with fertility, like Clomid. And then if there is insulin resistance, some medications that can help, in addition to those, would include metformin. Okay.
Okay, thank you very much. Apparently, Dr. Hope is not hearing me, but live over there on YouTube can hear me. Apology for that. Uh,
Okay.
uh, we're trying to work more on our devices. Apology for that. Uh,
Okay.
uh, we're trying to work more on our devices. Oh, okay, great. You can hear me now.
Okay.
All right, Dr. Hope. I didn't know what happened. I got lost in the audio signal. Okay. I hope you can hear me now. Um, all right, Dr. Hope. I didn't know what happened. I got lost in the audio signal. Okay. I hope you can hear me now. So
Yes, I can. Yep, I can hear you. So we can talk about fertility.
yeah, I see a
Oh, what
question.
are the causes of fibroids?
Mm.
Which the fibroids is not really an endocrine problem. It's more OBGYN problem. It's not hormonal necessarily. Well, it could be made worse with estrogen, but it's treated by OBGYN doctor. But some of the treatments are DNC to actually remove the fibroids themselves, or surgery to remove the fibroids. How can it affect fertility? It can take up space in the uterine cavity, so that when someone becomes pregnant and the baby is growing, the fibroids also grow, because estrogen feeds the growth of fibroids. So as the baby grows, the fibroids grow, and there's competition for space in the uterine cavity. And so it can actually affect the growth of the baby. So that's why it's recommended that your fibroids are treated prior to becoming pregnant. But that's usually treated with an obstetrician, a gynecologist doctor.
Hmm. So fibroid does not affect infertility. It does only if it is so big enough that it occupies the whole space in the uterus, which is the womb. That's when you could have problem with baby staying in your womb. But otherwise, it's usually doesn't. It's not hormonal to cause you not to get pregnant. It only fights with the site where your baby is supposed to be implanted, you know. And it also depends on where the fibroids are located. Sometimes they are located inside the womb where the baby is to be implanted, and sometimes it's attached like a skin tag on the womb itself, or around the womb, or outside the womb bag. So it's best, as Dr. Hope said, to let your GYN, your manage you better on that. So I think my voice is stucking on the computer. Uh, I don't know what is going on with the computer system today. Our apology. So if you still have more questions, please drop it in the chat. We will be very glad to answer this question um, afterward or in our next video. So we can work more on this computer thing today that is bringing or voice overlay. Afterward or in our next video. So we can work more on this computer thing today that is bringing or voice over. Very glad to answer this question afterward or in our next video. So we can work more on this computer thing today that is bringing or voice very glad to answer this question. Okay, right, Dr. Hope? Thank you all for joining us today. We appreciate your time, and your questions are wonderful. We love them. So we will come back again and we'll be much better. Thank you, and have a great day.
It takes 21. Wait, no.